Sexuality, sexual health and responsible sexual behavior. Sexuality refers to an individual's sexual orientation, preferences, and behaviors. Sexual health refers to the physical, emotional, and social well-being related to sexuality. Responsible sexual behavior involves making informed decisions about sexual activities that prioritize safety, respect, and consent. Examples of responsible sexual behavior include 1. Consenting to sexual activity. Both partners should be fully consenting before engaging in sexual activity. Consent means that all parties involved have freely agreed and have the capacity to understand the consequences of their actions. 2. Protection against sexually transmitted infections (STIs). Using condoms or other forms of protection during sexual activity can reduce the risk of contracting STIs. 3. Regular STI testing. Regular STI testing is essential for detecting and treating sexually transmitted infections early. 4. Contraception. Using contraception, such as birth control pills, condoms, or IUDs, can prevent unintended pregnancies and allow individuals to plan their families. 5. Communication. Clear and honest communication with sexual partners can help to establish expectations, boundaries, and safety measures. Overall, responsible sexual behavior involves making informed decisions about sexual activity that prioritize safety, respect, and consent. It is essential to prioritize sexual health and access resources and education about responsible sexual behavior. Sexual practices. Sexual practices refer to the various activities, behaviors, and preferences that individuals engage in during sexual activity. Some common sexual practices include 1. Vaginal sex, penetration of the vagina by the penis or other objects. 2. Anal sex, penetration of the anus by the penis or other objects. 3. Oral sex, sexual activities involving the mouth, such as fellatio stimulation of the penis with the mouth, or cunnilingus stimulation of the clitoris or vagina with the mouth. 4. Masturbation, sexual stimulation through touching oneself. 5. Kissing and touching, intimate touching and kissing of the body, including the breasts, genitals, and erogenous zones. 6. BDSM, bondage, dominance, sadism, and masochism practices may involve elements of pain or humiliation during sexual activity. It is important for individuals to practice safe and consensual sexual activity, communicate with their partners, and respect each other's boundaries and needs. Additionally, understanding and respecting cultural or religious beliefs around sexual practices is crucial for promoting a healthy and positive sexual experience. Homosexuality. Homosexuality refers to romantic, emotional, or sexual attraction to individuals of the same sex. It is a natural variation of human sexuality and occurs across cultures and time periods. People who are attracted to the same sex may identify as gay, lesbian, or queer. Homosexuality has been stigmatized historically and continues to face social, legal, and cultural challenges in many parts of the world. However, there has been significant progress towards greater acceptance and recognition of LGBTQ+, lesbian, gay, bisexual, transgender, and queer rights in recent years. It's important to note that homosexuality is not a mental disorder or a choice, and attempts to change or suppress one's sexual orientation can be harmful to one's mental health and well-being. It's essential to create a supportive environment and promote inclusivity and diversity to ensure that everyone feels safe and respected, regardless of their sexual orientation. Bisexuality. Bisexuality refers to romantic, emotional, or sexual attraction to people of both the same sex and different sexes. Bisexual people may identify as attracted to people of any gender and may experience their attraction in different ways. Bisexuality has been historically misunderstood or stigmatized, and bisexual people may experience harassment, erasure, and discrimination within both heterosexual and LGBTQ+ communities. Bisexual individuals may also face unique challenges, such as being invalidated by others' assumptions about their attraction, or feeling pressure to conform to either a heterosexual or homosexual identity. It's important to recognize that bisexuality is a valid sexual orientation, and that individuals should be able to identify and express themselves as they feel most comfortable. Promoting education, understanding, and inclusivity of all sexual orientations, including bisexuality, can help create a safer and more supportive environment for everyone. Incest. Incest refers to sexual activity or relationships between closely related family members. This practice is taboo in most cultures, and laws against incest exist in nearly all societies. Incest can have negative genetic effects on offspring and can cause emotional and psychological harm to the individuals involved. It is considered a form of sexual abuse, especially when it involves a power dynamic between family members or coercion. As such, incest is generally considered immoral and illegal, and individuals who engage in it may be punished by law. It is important to provide education and resources on healthy sexual relationships and to create a safe and supportive environment for individuals who may have experienced incest. Defilement. Defilement, also known as sexual abuse, refers to any unwanted or non-consensual sexual behavior towards another person, often involving physical or emotional harm. This can include acts such as touching or kissing without consent, rape, or any other form of sexual violence. Defilement is a serious criminal offense and is typically punished by law. Victims of defilement may suffer from physical and emotional trauma, including post-traumatic stress disorder (PTSD), anxiety, depression, and other mental health issues. Sexual abuse can happen to anyone, regardless of age, gender, sexual orientation, or ethnicity. It is important to provide education, support, and resources to individuals who may have experienced defilement, including access to counseling, medical care, and legal assistance. Preventing defilement requires creating safe and respectful environments, challenging harmful rape culture attitudes, and holding perpetrators accountable for their actions. Prostitution. Prostitution refers to the exchange of sexual services for money or other forms of compensation. This practice is illegal in many countries and is often stigmatized. Prostitution can involve individuals of any gender and may be voluntary or forced. Individuals who engage in prostitution may face physical and emotional risks, including violence, exploitation, and health issues such as sexually transmitted infections. Reducing the harm associated with prostitution may involve providing access to medical care, safe working conditions, and legal protections for sex workers. Alternatives to prostitution, such as education and job opportunities, can also help individuals avoid entering sex work in the first place. Addressing the root causes of prostitution, such as poverty, gender inequality, and exploitation, requires broader social and economic changes. Additionally, addressing the demand for prostitution and empowering individuals to make informed choices about their bodies and sexuality can promote healthier and more equitable relationships. Rape. Rape refers to any non-consensual sexual act, including unwanted sexual penetration, forced kissing or touching, or any other form of sexual violence. Rape is a serious crime and a form of sexual assault, characterized by the lack of consent of the victim. Rape can have severe physical and emotional effects on the victim, including post-traumatic stress disorder (PTSD), depression, anxiety, and other mental health issues. It is a violation of an individual's basic human rights and dignity. To prevent rape and support its victims, it is important to raise awareness about the issue, provide education on healthy relationships and consent, and hold perpetrators accountable for their actions. This can involve legal action, counseling and medical care for victims, and punishment for offenders. Additionally, preventing rape requires challenging harmful rape culture attitudes that normalize sexual violence and empower individuals to speak out against it. This includes promoting gender equality, respecting personal boundaries, and creating safe and inclusive environments for all individuals. Masturbation. Masturbation refers to the act of stimulating one's own genitals for sexual pleasure. It is a common and natural form of sexual expression and is practiced by people of all genders and ages. Masturbation can have a range of physical and emotional benefits, including stress relief, improved sleep, and increased self-awareness and body positivity. It can also be a safe and healthy way to explore one's own sexuality without the risk of sexually transmitted infections or unwanted pregnancy. Despite its many benefits, masturbation can be a stigmatized topic, and individuals may feel shame or guilt for practicing it. However, it is important to recognize that masturbation is a normal and healthy aspect of human sexuality and should be destigmatized. Education and open dialogue about masturbation can help individuals feel more comfortable and confident in their sexuality. Additionally, It is important to promote access to safe and accurate information about sexual health and pleasure, as well as provide resources and support for those who may be struggling with feelings of shame or guilt related to masturbation. Causes of irresponsible sexual behavior. Irresponsible sexual behavior can have a range of underlying causes, including 1. Lack of education. A lack of comprehensive sexual education can leave individuals with inadequate knowledge of sexual health, safety, and consent, leading to risky behavior. 2. Peer pressure. Social pressure to engage in risky sexual behavior or conform to sexual norms can lead individuals to make poor choices. 3. Engaging in substance abuse. The use of drugs or alcohol can impair individuals' judgment and ability to make safe choices related to sexual behavior. 4. Mental health issues. Mental health issues such as depression, anxiety, and trauma can contribute to irresponsible sexual behavior, especially if not properly addressed or treated. 5. Sexual trauma. Individuals who have experienced sexual assault or abuse may struggle with intimacy and boundaries and may engage in risky sexual behavior as a way of coping with their experiences. 6. Lack of access to health care. Limited access to health care, including contraception and STI testing and treatment, can contribute to irresponsible sexual behavior. 7. Cultural and societal factors. Societal expectations and cultural norms surrounding sexuality can contribute to unhealthy attitudes and behaviors related to sex. It is important to address the underlying causes of irresponsible sexual behavior through comprehensive sexual education, access to health care, and supportive resources for mental health and trauma. Additionally, promoting healthy attitudes and norms surrounding sexuality can help individuals make informed and responsible choices about their sexual behavior. Consequences of irresponsible sexual behavior. Irresponsible sexual behavior can have a range of negative consequences, including 1. Unplanned pregnancy. Engaging in unprotected sex or not using reliable contraception increases the risk of unintended pregnancy, which can have significant emotional, social, and financial impacts. 2. Sexually transmitted infections (STIs). Risky sexual behavior can increase the risk of contracting STIs, which can have long-term health consequences and may lead to infertility or other health problems. 3. Emotional distress. Engaging in sexual behavior before one is ready or with partners who do not value consent or mutual respect can lead to feelings of shame, guilt, and emotional distress. 4. Social stigma. Engaging in sexual behavior that is seen as socially unacceptable can result in social stigma, discrimination, and even exclusion from social groups. 5. Relationship problems. Irresponsible sexual behavior can strain relationships and lead to mistrust, jealousy, and other issues. 6. Legal consequences. Engaging in sexual behavior with partners who are not of legal age, or without obtaining their explicit consent, can result in legal consequences, including charges of sexual assault, rape, or statutory rape. It is important to promote responsible sexual behavior through comprehensive sexual education, access to health care, and supportive resources for mental health and healthy relationships. Encouraging individuals to prioritize their own sexual health and that of their partners can help reduce the negative consequences of irresponsible sexual behavior. Ways of preventing irresponsible sexual behavior. There are various ways of preventing irresponsible sexual behavior, including 1. Comprehensive sexual education. Education that covers information on sexual health, safety, consent, communication, relationships, and respectful behavior can equip individuals with the knowledge and skills to make informed decisions about their sexual behavior. 2. Access to health care. Access to health care, including contraception, STI testing, and treatment, can help individuals protect their sexual health and prevent unintended pregnancies and STIs. 3. Positive cultural and societal norms. Promoting attitudes and norms that value respectful relationships, consent, and healthy sexual behavior can encourage individuals to make responsible choices and reduce the incidence of unhealthy sexual behavior. 4. Substance abuse prevention. Prevention efforts aimed at reducing substance abuse can limit the negative impact of drugs or alcohol on individuals' decision-making abilities and reduce the likelihood of engaging in risky sexual behavior. 5. Supportive resources. Providing resources for mental health, trauma, relationship counseling, and support groups can help individuals navigate complex issues related to sex and sexuality and make responsible choices. 6. Peer programs. Peer-led sexuality education and prevention programs can help youth gain a better understanding of the risks and consequences associated with engaging in irresponsible sexual behavior and promote healthy sexual behaviors and relationships. 7. Parental involvement. Parents can play a role in preventing irresponsible sexual behavior by communicating with their children about sex in an open and non-judgmental manner and providing guidance on healthy attitudes and behaviors related to sex. Overall, promoting a culture of responsibility and mutual respect in sexual behavior can help reduce the incidence of irresponsible sexual behavior and its negative consequences. Social cultural factors influencing sexual behavior. There are several social and cultural factors that can influence sexual behavior, including 1. Religious beliefs and values. Religious beliefs can promote abstinence before marriage or limit the acceptability of certain sexual practices or behaviors. 2. Gender norms and expectations. Societal expectations around gender roles can influence sexual behaviors, such as cultural views on masculinity and femininity, and the role of men and women in initiating or consenting to sexual activity. 3. Media and popular culture. Images and representations of sexuality in media and popular culture can shape attitudes towards sex, body image, and sexual norms. 4. Peer pressure and social influence. Social and peer pressure can influence sexual behavior, such as seeking acceptance or approval from friends or engaging in behavior to meet social norms or expectations. 5. Education and access to information. Access to comprehensive sex education can provide individuals with knowledge and skills to make informed decisions about their sexual behavior. 6. Social and economic status. Social and economic status can impact sexual behavior, such as access to resources, education, and healthcare resources. 7. Legal and political factors. Legal and political factors, such as laws around consent, marriage, and reproductive rights, can influence sexual behavior. Overall, social and cultural factors can significantly impact sexual behavior, and understanding their influence can help develop interventions and strategies to promote healthy sexual practices and attitudes. Responsible sexual behaviors. Responsible sexual behaviors refer to practices and actions that prioritize safety, health, and consent in sexual activities. Some examples of responsible sexual behaviors include 1. Consistent and correct use of contraception. Condoms, birth control pills or other forms of contraception can prevent unplanned pregnancies and reduce the risk of sexually transmitted infections (STIs). 2. Open and honest communication about sexual history and practices. Being honest and open with sexual partners can help avoid misunderstandings or potential risks. 3. Mutual consent. All sexual activities should be based on mutual consent and respect for each other's boundaries. 4. Regular STI testing. Regular testing for STIs is important to detect and treat infections early and prevent the spread of infections. 5. Safe sex practices. Sexually active individuals should practice safe sex and keep themselves and their partners safe by using condoms or other forms of contraception, and avoiding high-risk sexual behaviors. 6. Mutual respect for sexual partners. Each sexual partner should be treated with respect and consideration, and should not be pressured into sexual acts or desired behaviors. 7. Seeking medical help and support. Consulting a doctor or a sexual health counselor for advice on sexual concerns or issues, and receiving treatment or support for sexual dysfunction can help maintain sexual well-being. In summary, responsible sexual behaviors emphasize respect, communication, safety, and consent between sexual partners in all aspects of their sexual relationship. Irresponsible sexual behaviors. Irresponsible sexual behaviors refer to practices and actions that disregard safety, health, and consent in sexual activities. Some examples of irresponsible sexual behaviors include 1. Not using contraception. Engaging in sexual activities without the proper use of contraception can lead to unintended pregnancy, and increase the risk of sexually transmitted infections (STIs). 2. Non-consensual sexual acts. Engaging in sexual acts without mutual consent is considered sexual assault, and is a serious offense. Sexual acts should only occur with the explicit agreement of all parties involved. 3. Sexual coercion. Using pressure or manipulation to engage in sexual activities with another person who is unwilling or hesitant is considered sexual coercion, and is a form of sexual assault. 4. Engaging in high-risk sexual behaviors. Engaging in high-risk sexual behaviors, such as having unprotected sex with multiple partners or sharing needles during intravenous drug use, can increase the risk of STIs and other health issues. 5. Lack of communication about sexual history and practices. Refusing to communicate openly and honestly about sexual history or practices can put sexual partners at risk for STIs or unintended pregnancy. 6. Failure to seek medical help and support. Refusing to seek medical help or advice for sexual health concerns, such as STIs or sexual dysfunction, can lead to further health issues, and put sexual partners at risk. 7. Using drug and alcohol during sexual activities. Using drugs or alcohol during sexual activities can impair judgment, and increase the risk for unintended pregnancy, STIs, sexual assault, and regretted decisions. Overall, engaging in irresponsible sexual behaviors can have serious consequences, such as unintended pregnancy, STIs, sexual assault, and other health issues. It is important to prioritize safety, health, and consent in sexual activities, and to communicate openly and honestly with sexual partners. Ways of coping with adolescent sexuality and sexual behavior. Coping with adolescent sexuality and sexual behavior is a delicate matter for parents, caregivers, and educators. Here are some ways to cope with adolescent sexuality. 1. Communicate openly. Engage in open and non-judgmental communication about sexuality with the adolescent. Provide accurate information, answer their questions, and address their concerns. 2. Promote safe sex practices. Encourage the adolescent to use condoms, birth control, or other forms of contraception to prevent sexually transmitted infections and unwanted pregnancies. 3. Set age-appropriate boundaries. Establish age-appropriate boundaries, rules, and expectations around dating, sexual behaviors, and relationships. 4. Foster healthy relationships. Educate the adolescent on what a healthy and respectful relationship looks like. Emphasize the importance of consent and empower them to be assertive in their relationships. 5. Address problematic behaviors. Address problematic sexual behaviors, including sexual harassment, assault, and abuse. Ensure that the adolescent knows that this behavior is unacceptable and provide support for victims. 6. Seek professional support. If the adolescent is struggling with sexual issues or problematic behavior, seek professional support from a therapist or counselor. Coping with adolescent sexuality can be challenging, but fostering open communication, promoting safe and healthy behaviors, and seeking professional support when needed can help parents, caregivers, and educators navigate this complex issue. Revision exercise. 1. Outline ways young people can practice responsible sexual behavior. Young people can practice responsible sexual behavior through 1. Using contraception. Using contraception is crucial in preventing unplanned pregnancies and sexually transmitted infections. Young people should be educated on the various types of birth control options available and how to use them effectively. 2. Regular testing. Young people who are sexually active should receive regular testing for sexually transmitted infections. Testing can be done at a sexual health clinic, a doctor's office, or through a home testing kit. 3. Respect for partners. Young people should be taught to respect their partners and their boundaries. They should be aware of the importance of consent and understand that pressuring someone into sexual activity is never acceptable. 4. Communication. Open communication with sexual partners about boundaries, expectations, and preferences is vital. Young people should feel comfortable discussing these topics with their partner before engaging in sexual activity. 5. Avoiding risky behaviors. Engaging in risky sexual behaviors, such as unprotected sex or having multiple partners, can increase the risk of unplanned pregnancies and sexually transmitted infections. 6. Seeking professional support. Young people who are struggling with sexual issues, sexual trauma, or problematic behavior should seek professional support from a therapist or counselor. 2. Name the sexual behaviors punishable by law in Tanzania. In Tanzania, the following sexual behaviors are punishable by law. 1. Homosexuality. Homosexuality is illegal under Tanzanian law and is punishable by up to 30 years in prison. 2. Same-sex sexual acts. Sexual acts between people of the same sex are illegal under Tanzanian law and are punishable by up to life imprisonment. 3. Prostitution. Prostitution is illegal under Tanzanian law and is punishable by up to 5 years in prison. 4. Sexual harassment. Sexual harassment is illegal under Tanzanian law and is punishable by a fine and imprisonment of up to 3 years. 5. Rape. Rape is illegal under Tanzanian law and is punishable by up to life imprisonment. It is worth noting that Tanzania has strict laws around sex and sexual behavior, and the country's government has been criticized for its harsh stance on homosexuality and other sexual practices. 3. Why is sex education important? Sex education is important for several reasons. Here are a few. 1. Preventing unplanned pregnancies. Comprehensive sex education can teach young people about contraception, which can prevent unplanned pregnancies and reduce the number of abortions. 2. Reducing the spread of STIs. Sex education can teach young people about sexually transmitted infections STIs, how they are spread, and how they can be prevented. Education can also help reduce the stigma around STIs and encourage early diagnosis and treatment. 3. Promoting healthy relationships. Sex education can teach young people about healthy relationships, communication, and consent. This can help prevent sexual violence, sexual harassment, and unhealthy relationships. 4. Providing accurate information. Sex education can provide young people with accurate information about their bodies, sexual health, and relationships. This can help dispel myths and misconceptions and promote positive attitudes around sex. 5. Empowering young people. Sex education can empower young people to make informed decisions about their bodies, sexual health, and relationships. It can help young people feel more confident and comfortable in their sexuality and can reduce anxiety and shame around sex. Overall, sex education is important because it can help promote sexual health, prevent sexual violence and harassment, and empower young people to make informed decisions about their bodies and relationships.